Okay, good morning, you're all good to go? All right, good morning. Joined here today by Mark, our colleague from Auslan, and also Naomi Bromley, who's the Deputy Secretary for our Vaccination Programme. I can also just extend my thanks to Naomi, Kate Matson and the rest of the team for their work. Particularly the last week or so, I took some time off. It's always good to have a stronger team behind the scenes and in front of the scenes, so my thanks to them. I'm sure we'll see more of them in the coming days and weeks. I'm delighted to announce that today we have 0 positive new cases of COVID in the community here in Victoria, and also 0 cases in hotel quarantine. We still have, unfortunately, 9 people in hospital with coronavirus, 2 of whom are in ICU, and both of those are on a ventilator. And of course, we send our very best wishes to all those 9 people and to the others who continue to recover from coronavirus here in Victoria. In terms of the overall outbreak that we've been talking about since the middle of June, since the 12th of June, we've had a total of 220 cases. There are now 99 of those remain active at this point in time, and they continue their recovery. We had over 400 exposure sites. We're now down to 33 exposure sites we continue to manage. I'll talk about a couple of those in a moment. We've undertaken a total of 815,000 coronavirus tests since the 12th of July, 30,117 of those yesterday. That gives us an average of around 32,000 tests a day during this entire outbreak. And again, as we've seen in previous outbreaks here in Victoria, it's those sustained high and effective testing numbers that are so important in giving our public health team a really good understanding of the pattern of community transmission, and it's enabled us to get on top of it so very quickly. 99% of our tests continue to come back well within the next day. In total, we've had around 40,000 primary and secondary close contacts that we've been working with over the duration of this outbreak. Another 407 were cleared and released yesterday, and we're now down to fewer than 3,000 primary close contacts who continue to isolate on behalf of the rest of us. And again, my thanks, of course, to those 40,000 people for having done the hard yards over the last few weeks in isolating and ensuring that the virus stops with them, and of course the just under 3,000 that are still continuing their isolation over the coming days. I am pleased to confirm we're starting our day 13 testing now at the La Crosse apartment buildings. It's a fair number of those 3,000 tied up with that particular outbreak or that exposure site, and hopefully we hope to release a number of them over the coming days once the negative test results come through and they finish the closeout process. We're also continuing to work with particularly the exposure site at Woolworths at Doncaster. 195 primary close contacts associated with that site. 89% of them have already returned a negative test result. And at the wider Moonee Valley outbreak associated with our traffic controller, 261 people associated with that particular outbreak, 91% of them have returned a negative test result already. They'll of course continue their isolation all the way through to day 14. So in terms of the overall outbreak, we obviously have still more work to do. These outbreaks are not over until we've got everybody cleared, until all remaining leads have been closed down, all exposure sites released. And my thanks to all the public health teams for their ongoing work to drive this outbreak fully into the ground. We continue, of course, to maintain our focus on interstate risks. We now have 7,985 active red zone permits, or people who've returned from red zones, particularly Canberra and southeast Queensland, who are currently isolating within Victoria. So these are Victorians who've travelled back on valid red zone permits over the last 14 days. Those permits continue to be active. We continue to work with those people, and I again stress to those red zone returnees, it is so important you continue to maintain your isolation. All the checks we're doing indicate people are maintaining those protocols, but as we've seen to our cost in the last couple of months now, the risk of interstate incursion is very great. Now that we're starting to get back to 0 new cases, we're very, very keen, of course, to maintain that pattern for as long as we possibly can. I should add, of course, there are exemptions possible. Now, the process of exemptions is really only for a very small category of people. Exemptions are for those genuine, urgent and compassionate reasons that people have whereby they need to travel from either New South Wales as an extreme risk area, or if they're a non-resident but in Canberra and in southeast Queensland and they still wish to return to Victoria. But exemptions are only given for those very rare reasons. They are exemptions, they are not a right of return. And I stress again, if you're a Victorian in Canberra or in southeast Queensland, you can apply for a red zone permit and return under those restrictions. If you are Victorian or anybody else in New South Wales and you have a genuine and urgent and compassionate reason to be back in Victoria, you can apply for an exemption. I cannot guarantee that you'll be given a positive response. We will work with you to assess your individual situation, and it will be something which takes a while to process through. We've been talking about this challenge for a number of weeks now. Our team will continue to do all we can to support those exemptions, but we'll do so to manage that risk for the wider community, not just each individual case. Finally, last night we made a number of changes to our border directions, to border bubble arrangements. I think it was trailed fairly widely yesterday. Those changes came into effect at midnight, and the purpose for us to have the border bubble is to enable as much as is safe and as reasonable ease of movement for border residents between New South Wales and Victoria, predominantly those LGAs that directly border or directly touch the border between our two states. We have always maintained that border bubble operation throughout this year through the various border closures that we've had, and we are continuing at this point in time to enable ongoing travel across the border for those border residents without a permit at this time. But there are a number of significant conditions associated with that. The first of which is that anybody who wishes to use this border bubble arrangement needs to be resident in one of those adjoining border LGAs, but also not to have been in the wider extreme risk or red zone area in the preceding 14 days. You cannot travel from across New South Wales, end up in a border LGA, and then decide to come into Victoria. You need to not have been in the wider parts of New South Wales for at least 14 days. And there are permitted reasons for coming across. Those permitted reasons include, obviously, paid or voluntary work, education, necessary goods and services, such as medical care or getting a COVID-19 test, or even getting a vaccination. Club-related sport and exercise, if you have a fixture or something else that takes you across the border, if you're in those border communities, that's acceptable. Visiting an intimate partner, moving house, or if there's another functional local work-based reason for you to come across the border. They're all set out on our website, and I'd urge members of the border community, please continue to check our website for guidance about the movements we are keen to continue to support, but also there's other reasons that we're now saying, please, we want to minimise the number of movements where we can, we want to minimise the risk of New South Wales transmission back into Victoria. Obviously happy to take any questions on that a bit later. I'll now ask Naomi to talk through our vaccination programme, and then we'll go to questions. Thank you.
Thanks very much, Jerome. Can I thank the 17,000 people who got vaccinated yesterday, all of whom have helped us get one step closer to normal. There are going to be more opportunities for people to do just that over the next month. Thousands of AstraZeneca appointments are open, with walk-up also available. On top of the 200,000 people who are already booked in for Pfizer over the next month, almost 60,000 more appointments are now open for booking. There continue to be appointments set aside for priority healthcare workers, aged care workers and disability workers. Now that's the most appointments we've ever had for both vaccine types in the Commonwealth system, in the Commonwealth program, particularly with our ongoing Pfizer constraints. We can do this in part because we revised the recommended Pfizer second dose interval to 6 weeks. That frees up supply available for the first appointments now, because we can cover the subsequent second dose appointments when our supply increases come September and October. So currently there's an average of 14,000 Pfizer appointments available every week from the 9th of August through to the 5th of September, and Victorians can book online or phone at one of our 50 sites, or of course you can continue to look for appointments with your primary care provider in your local area. Now we know how effective these vaccines are. We need look no further than the recent outbreak, where none of the locally acquired COVID cases hospitalised so far from the July outbreak were fully vaccinated. More than 1.6 million doses have been delivered through the Victoria's state-run system. That's more than any other state or territory. Today we'll hit 1.7 million in the state system, and we're sitting at around 3.4 million for the Victorian system in total. We continue to work really closely with general practice, pharmacists, the Aboriginal community controlled sector, who are also administering the vaccine and doing a fantastic job. It's that partnership that's going to take Victoria to 80% vaccinated and beyond. But we continue to rely on the enthusiasm of the Victorian people too, so please do come forward, get vaccinated, get protected and help us get back to normal. I'll hand back to Jerome.
Question on getting more people vaccinated. Will you be changing the eligibility? If you've got 60,000 Pfizer spots available, will you be lowering it from 40?
Not at this time. So I mean, we're very clearly sticking with the wider Commonwealth prioritisation programme, and vaccine eligibility now is for all those Victorians aged 40 and above, plus a number of additional specified groups. So we're not changing that. Obviously, we'll continue to work within the national programme, and as that continues to evolve over the weeks ahead, then we'll do what we can to follow it.
The ACT lowered its eligibility criteria, and they've seen a huge take-up amongst 30-year-olds. So why won't Victoria do that? We're talking about there's evidence seen in Sydney, 20 and 30-year-olds, spreaders, and the people are catching this virus. When will the state open up to younger people? Sure.
So I might ask Naomi to comment on that in a moment. But look, what I will say is, as Naomi's made clear, the constraint here is supply. So we have no shortage of people in the current eligible work groups, the 1A, the 1B, those 40 and above, who want to come forward and get vaccinated. Our constraint this month has been, or will continue to be, availability of supply. We've now managed to harvest and bring forward some additional Pfizer vaccines to those age groups. We'll continue to make that available, but right now the constraint is supply, not the number of Victorians wanting to come forward.
Jerome, we heard 3 weeks ago that some younger people were dropping by state hubs to see if there were any leftovers. Is that still happening to your knowledge, and are you comfortable with that happening?
Look, to my knowledge, no, not systemically. So clearly, we've seen before people will go into the various clinics, both the GP clinics and to our state centres on the off chance. We've been very clear, very consistent with our clinics around which people are eligible. We are part here of a national vaccine programme. We've been very careful here in Victoria to ensure we always back in the national parameters around that programme. But as Naomi said, what we have done is we've gone harder and faster as we possibly can. We're seeing really good penetration levels now amongst the over 40s. We're keen to ensure that those more vulnerable members of our community get done. That's why there's, whatever Pfizer we've got available, we're making that available again today. Obviously, we've got Astra that continues to be available. For anybody who's not sure, who's confused about what's right for them, as we've said all along, go and talk to your GP and they'll give you the best advice that's relevant for them.
But if young people want Pfizer leftovers that are going to get thrown out anyway, should they be allowed to get that?
We don't throw out Pfizer. So we've got, again, the wastage volumes we're getting, the wastage amount we're seeing within the Victoria system is exceptionally low. It's I haven't got the numbers in my head, but it's very low. Naomi may have it, she may want to come and correct me. So we're not seeing wastage of Pfizer at the end of the day. Our clinics are running at a really rigorous and robust and professional system. We are not seeing wastage of any vaccine in our system.
We saw a breakdown of the suburbs and vaccination rates around Melbourne as the northwest and the west, where they're only at around 15%. Is there anything being done in these certain areas to boost rates? Is there anything restricting these people from these suburbs from having that?
Thanks, it's a really good question. We really welcome that data being made publicly available. We monitor uptake across the state and look at all the available data all the time, and we're really keen to see equity and access across the whole state. Now, in relation to some of those LGAs that are a little bit lower, the age profile is quite relevant, so there might be less people in those areas who are currently eligible. But in all of those LGAs and in all of those parts of Melbourne, we work with local stakeholders, talk to primary care about what's happening, and look at our state system and think about where we can open up more access. There will be additional hubs and points of access coming online in future weeks, but we also think about where we can push additional doses into the state system to make sure that there is equitable access across the whole of Victoria for people who are eligible.
Could there be incentives offered in those LGAs to get people the jab? Go get the jab?
I think incentives is something that's really interesting. There's been a lot of discussion about it recently. It's not something that we're looking to incorporate into the state system at this point in time, but future discussions about incentives and passports and all of those things will become more relevant over coming months. The key thing is now that not everyone is eligible, and so we really need to get to the point where we've got enough supply so that everyone has the opportunity.
How far off is that in your sort of horizon, if you feel like? When are we going to get
So our horizons are the Commonwealth's horizons, which are publicly available. So we're really looking forward to September, October, November as being the months where we hope to see a lot more supply becoming available all across Australia, but particularly here in Victoria, into our state system and also into our general practice system, and increasingly into pharmacy as well.
If 40s to 60s aren't taking it up, at what point do you look at that hesitancy and say, well, we're going to need to open it up to, say, people between 20 and 30 who seem to be more keen, as a generalisation, to get the vaccination?
I don't think it's true to say that 40 to 60-year-olds aren't taking it up. So the appointments that I've just announced today, I expect there'll be a huge uptake of those. And in fact, we just continue to see, as we're able to release more appointments, they get taken up really, really quickly. So supply continues to be the limiting factor, not hesitancy or even complacency here in Victoria. Now, we know that there are many, many people in their 30s and their 20s who are really keen to get vaccinated, and we are very much looking forward to the day when they become eligible. We will continue to align with the Commonwealth program and with the ATAGI's advice about eligibility, both in our state system, but we'll also align really closely with what's happening in the general practice system. It won't be too far in the future if the supply horizons come to bear.
We talk a lot about hesitancy or anti-vaxxers. How much of a factor in the, I don't want to say low take-up, how much of a factor in the current take-up rate is the just general level of confusion around who is eligible, where they can get it, how they book, just those kind of more practical inhibitors? Yeah,
sure. So, look, I think there has been confusion, at different points in the program. With a cohort-based approach, it's not as simple to understand as an age-based approach. That's absolutely true. Again, I would just say supply is our limiting factor. We don't have a huge hesitancy or a huge complacency problem here in Victoria. More people want to get vaccinated now within the eligible cohorts than we have supply for. So we need to manage really carefully over the next couple of weeks and months. We'll continue to harvest and make sure that we are making the most of the supply that we have available here in Victoria. And as more becomes available, more people will become eligible, and then they'll get opportunities to come forward to the exhibition buildings at McKeck and all of the other amazing locations, as well as literally hundreds of GPs and pharmacists all across the state who will be able to vaccinate people.
How advanced are the plans for new vaccination points? I asked Greg Hunt's office a couple of weeks ago whether the federal government was talking to, say, shopping centre groups, stadiums, all those areas where we could put new hubs. Are you guys having those conversations? And how advanced are they?
Yeah, look, absolutely. So our state system at the moment has 50 open access points all across the state. It can actually do more vaccines than we're currently doing at the moment. So we have more footprint and capacity than what we're actually utilising now. That means when supply becomes available, we'll be able to scale up. And at the same time, we're also looking at areas where the access might not be quite as strong and thinking about what additional points we might open up in the future. But that kind of base capacity we have of those 50 locations is actually a really strong footprint.
Is the government getting close to opening up in the government hubs, AstraZeneca, people under 60 with informed consent, given there are a lot of people who are under that age group who are willing to go and get it? Would it make sense to go and, it's sitting there, does it make sense to now open it up in those state centres?
We are actively considering that at the moment, and we think we'll have more to say on that in coming weeks.
Coming week? I mean, this is a race, so why coming weeks, not coming days? I mean, people are desperate. They're phoning around GPs to find where they can get the AstraZeneca. Why won't the state, I guess, help them?
Yeah, and so look, people in those age groups absolutely can go to GPs, and GPs have many, many access points all across the state and plenty of supply. So it's not that people can't access it. We are looking very closely at whether we open that access up in our state system. And again, we'll come back to you when we've got more to say about that.
How much Astra has the state got on hand sitting there ready to go?
I can't tell you off the top of my head. It's more than enough to continue on with the way we're going, and obviously all across the country there's a very good supply of AstraZeneca available both to all of the state systems across the country and to general practice. So there's not a supply constraint with regard to AstraZeneca.
So it would make sense to open it up in the state centres?
It's under active consideration.
Jerome, just can I ask you about zero new cases today. Obviously a cause for celebration for a lot of Victorians.
Mm.
Brett Sutton tweeted a photo of Ariane Titmus's coach going nuts after she won gold. How did you mark the moment, and what do you think it means for the psychology of Victorians at the moment?
I think for all Victorians, it's a moment of I think quiet celebration, quiet satisfaction. I think there's still a long way to go. So I think we should absolutely note the fact that today it's a symbolic marking of the point where there's no more COVID cases. We've dealt with yet another outbreak here in the state. It's the second time we've taken a Delta outbreak from zero all the way back down to zero again. I think the only place in the world that's done that, and that's something that all Victorians collectively have striven so hard to get us to where we are today. I say it's a brief moment of, I guess, of quiet satisfaction, because now we move on and say, well, how do we then sustain that? How do we manage? There's still 99 people who are living with COVID right now, active COVID right now here in Victoria. How do we support them over the days and weeks ahead and get all those remaining cases removed? And how do we then start to create an environment where we can maintain our COVID-free status until those vaccination rates lift? We can start to move towards the next phase of the government's roadmap.
What does this day of zero mean for our restrictions? Tuesday, I think next week is meant to be Monday.
Yeah, look at this point in time, obviously we've said the restrictions we're on at the moment will be in place until certainly next week. Obviously Brett and the rest of the team continue to review what does it tell us about the epidemiology. Right now this is a good day, it's an important day forward. We'll see over the coming days whether we've maintained this kind of trend.
What are the measures that you're keen to ease come next week?
Look, I think that'll be an issue that we'll look at when we're a bit closer to that time. So it's an important day. It's a really positive day. It means that we're on track with the strategy that we set 3 or 4 weeks ago when we first moved into this outbreak. We'll obviously want to release as much as we safely can, recognising that the risks are still around. We still have active cases within our community right here that we know about, the 99 active cases. We've still got just under 3,000 primary close contacts. I'd be really keen to get those released as soon as possible. And we still have ongoing risks in the rest of the eastern seaboard, and we'll be very keen to ensure that whatever settings we have continue to manage those appropriately.
Will household visits be on the cards, do you think?
It'll be a matter for Brett and the public health team over the coming days as they review the epidemiology. What's the appropriate balance of things to move into from next week?
There's still, as you just said, we aren't allowed visitors at home.
Right.
Are you worried complacency might start to creep in?
No, I don't think so. I think we've all been battle scarred. I think on this journey over the last 18 months, we've all known that you could do a fantastic job in getting an outbreak to ground, and then to have it only wiped away again a few weeks later when you see another incursion or another flare up happen. So we're very keen to ensure. I think all Victorians should be keen to ensure that we don't want to squander the gains we've had today. Only a week ago we found that new case in the community, the traffic controller. That was completely unexpected. It was not on the trajectory that we had 8 days ago, and suddenly you're dealing with a brand new case. So none of us should get carried away to say this is it, job done, we can now relax. This, I'm afraid, is going to be a process of eternal vigilance, not only for the public health team but for the whole Victorian community.
Do we know how the traffic controller got that virus?
Look, I think the team are reviewing again today. There are very strong indications, or there's a strong line of investigation around some movements that he had at work. The team is reviewing that again this afternoon, and if we can confirm that connection, then we'll announce that shortly.
Does it appear that a breach may have occurred at this workplace?
Too early to say. So, as I said, the team is reviewing a number of different factors over the course of today, and we've got some new information about movements around that particular work site, and it may well be that gives us a clear connection. We know that genomically it's connected, so it is part of this same Delta cluster that we've been working with over the last 3 or 4 weeks. But that's the last piece of the puzzle that I'm very keen to land in the next day or two.
Do you expect more people to test positive from that site?
Look, I think so far we've tested everybody at that site already in the first wave. They've all tested negative. There'll be another bout of testing that starts in the next few days. As we've seen in this outbreak and in previous outbreaks, we will of course see a number of primary close contacts who are isolating who will turn positive. That's why we ask them to isolate. So again, I would expect over the coming days we'll see more single-digit cases come up as those PCCs start to work out their isolation period.
How long are those border bubble measures likely to be in place?
Well, I think at this point for the foreseeable future, we've not set an exit time limit on it at this point. It's clearly completely associated with the progression of the pandemic in Sydney and in the rest of New South Wales. So we think it's an appropriate set of measures to have in place at this time, and we'll continue to review those options very carefully as we see things happening on the other side of the Murray.
Will there be any more financial support for the businesses being affected by that decision?
It's a matter for the government, so not a matter for me to comment on.
Just on the New South Wales border, apart from the bubble changes and the freight permit changes, are resources being put to, I don't know what this could entail, but increased surveillance to pick up cases that may have seeped in? Is there more testing around border areas? What are you guys doing to make sure that a case that comes in from New South Wales doesn't take weeks to show up in general testing?
Sure. Look, I think, Paul, there's a number of different things in place, and if you look at the armoury we've lined up to support border communities, and fundamentally we're managing a dynamic risk here. The simple, easiest thing to do would be just to slam the border shut and pretend that nothing exists beyond the Murray. That's not something we can, should, or want to do. So there's a huge amount of work going on to support as much movement as we can safely manage across the Murray and across the border. That includes, of course, the fact we have a red zone and an extreme risk zone management system. We have an exemption system to enable those critical, urgent and compassionate journeys to still take place in a very tightly controlled framework. We, of course, have got new arrangements in place for border communities to ensure that the nature of those journeys is done for good reason and where they have real value to add. We have wastewater monitoring in place across all the border LGAs that we do at least twice a week, every couple of days, to assess whether there's any changes in people who are in those border communities, any risk of seepage of cases over the border. And of course we continue to drill home the message that says, please, if you've got any symptoms, no matter where you are in Victoria, please come and get tested.
Last one, please.
Jerome, I don't know if you'll know this, but do you know what the status is of the ban on removalists from New South Wales? Because that 2 weeks would be up by now.
Yeah, that's still that provision is still in place. So we worked extensively with the freight industry over the last 2, 3, 4 weeks ago. We're continuing to have conversations with the interstate freight industry around how we continue to strengthen those arrangements. Those restrictions we introduced just under 2 weeks ago around removing a number of freight haulier types from that code are still in place, and we won't be changing that anytime soon.
If there are no, sorry.
Naomi, just one for you really quickly. The fact that the outbreak, the rates of vaccine uptake in those LGAs where the COVID has run rife previously, I know besides the fact that there's a lot of younger people there, how concerning is it that uptake is so low there when we have such an issue with COVID outbreaks there in the past?
Yeah, it's a really good question. So many of those areas that have been highlighted by the data that's been released have been areas that have also been really heavily impacted by COVID, particularly last year in Wave 2. That's why we have such a focus on equity and access. That's why we're looking at the data all the time, thinking about how we can use our state system to boost and to push into areas where it's really important, as it is across the state, that we have the highest possible vaccine uptake in line with the eligibility. As it stands at the moment, as we move forward over the coming months, when everyone's eligible, then that focus will become even more important.
Has anything been done to talk to the GPs in those areas to perhaps encourage their patients to get vaccinated?
We talk to GPs all the time, and we're working really, really closely with general practice all across the state, but including in some of those areas, and we will continue to do that. And that relationship is going to be so important with GPs and with pharmacy in how we look at access, encouragement, support, education all across the state and all across the different cohorts and age groups as they become eligible.
Would you say anything to the people living in those areas? Is it a bit of a wake-up call given that they have had such issues with COVID in the past?
The thing I would say to all of the people who are eligible in those areas, and of course all across the state, is please come forward and get vaccinated. Now is the time if you're eligible. There are appointments available. I know it's tough sometimes, but jump online, call the hotline, have a chat, try and find an appointment, but also talk to local GPs in your area and increasingly pharmacies as they come online. The people who are eligible now really need to come forward so that when it's the turn of people in their 30s and 20s, there's time and space for them to have their opportunity to come forward.
Okay, thank you guys.
Thank you.
Thank you, patients.
26 minutes, incredible.
That is incredible.